Now, while the national capital is still grappling with toxic levels of pollution in the air, where there seems to be no respite anytime soon, questions are being raised about the kind of technology that we are adopting to ensure that there is breathable air within the house. Yes, we're talking about air purifiers. Now, as air pollution continues to choke Delhi NCR, questions are being raised about whether the air purifiers really offer protection. Speaking exclusively to senior pulmonologist Dr G.C. Khilnani, who is also a member of the WHO Expert Committee on Global Air Pollution and Health, has cautioned against a false sense of safety. He said that even if the air purifiers shows low reading numbers like 5, 10 or 30, it does not mean the air is completely safe. According to him, most standard air purifiers are designed to trap particulate matter, but they do not block carbon monoxide, several harmful gases or ultrafine nanoparticles which continue to pose some serious health risks. He also stressed that cloth masks or simple surgical masks offer little protection and advised people to use N95 or preferably N99 masks when stepping outdoors. Most importantly, he urged residents to limit outdoor exposure, especially during early mornings when smog levels are at their highest. On air purifiers, experts say that they can help, but only under strict conditions. He also went on to say that the air purifiers must be correctly sized for the room, should have a HEPA filter along with an activated carbon layer, must remain switched on continuously, and the room should stay largely closed. Filters also need regular replacement, as poor maintenance can reduce effectiveness and, in some models, even lead to ozone generation. Experts also underline that the air purifiers are most beneficial for vulnerable groups, including those with chronic lung or heart disease, the elderly, and people who can stay indoors for long periods. For those who commute daily and spend long hours outside, relying solely on air purifiers can create an illusion of safety. The message is loud and clear. Air purifiers can reduce indoor pollution, but they are not a complete shield against Delhi's toxic air. The most effective protection remains reducing exposure, using the right masks, and limiting outdoor activity whenever possible. And to discuss this further, I am joined by our esteemed guest this afternoon. I'm joined by Dr. G.C. Khilnani, the Chairman, Department of Pulmonary and Critical Care, PSRI Hospital. Dr. Khilnani, thank you so much for taking our time and joining me over here. Now, this has almost been a path-breaking revelation of sorts as far as the effectivity of air purifiers are concerned, because there are several households in the national capital and beyond who feel that if they have a medium-sized air purifier at home, they are taken care of when it comes to protection against pollution. Mr. Khilnani, what do you have to say about it as far as the effectiveness of the air purifier is concerned? Do you agree with Dr. G to this entire WHO expert committee's guidelines?
So, what does air purifier do? It takes the air, atmospheric air, it passes through a filter, and it should pass through another HEPA filter and also an adsorbent, not AD, adsorbent, which should actually absorb the toxic gases like carbon monoxide, nitric oxide, sulfur dioxide. And then what we expect, that air which is emitted through the machine is 100% pure, devoid of all this. So it is not that I am against air purifier. That message should not go. But that we should understand the limitations of this machine. The first and foremost thing is that the air which comes out is not 100% safe. It may be better than the otherwise the toxic air that we are breathing. Another thing is that it is nearly impossible to keep the room 100% closed all the time. Eh, but having said that, those who are on oxygen because of the chronic respiratory disease, those who have chronic lung disease, those who are elderly 80 years plus, who don't have to go to work, at this point of time when the AQI is very poor or hazardous, should stay at home and then keep the doors closed. If they are using air conditioner, it should in the closed circuit mode. Then there is some amount of benefit would be there. Of course, yes, there is a potential harm of these purifiers emitting ozone, which can be harmful. But the few cautions I would like to say: one, that the people keep air purifier in the living room, oblique drawing room, and feel that their house is purified. That is absolutely wrong. The air purifier has to be in the closed room, and the capacity of air purifier has to be commensurate with the volume of the room. Another thing is that it should not be used like an air conditioner, that when we save electricity, when we are in the room, we put on the AC because it consumes a lot of electricity. Air purifier should be on all the time with the room closed, and the direction of air should be where you spend the maximum time. Now, some of the elderly patients that I have, they refuse to close the windows and doors. They feel uncomfortable. They feel claustrophobic. They said, "Come what may, we cannot close the windows. We feel suffocated." This is probably related to their psyche, but you really cannot change it. Why I'm nobody should go with the idea that I'm anti air purifier, but only thing is that it should be used properly. It should be used for particular person, and the method of use should be correct to have some amount of benefit. Benefit cannot be 100%. As I said in my previous utterances, that as a member of WHO, I did contest with the other members of the international body that air purifiers are being used in city of Delhi NCR because our air quality is very poor. But what they said that there is no scientific evidence of benefit in the health status. That is yet to be brought out convincingly that air purifier leads to better health. That is where we are as far as the science is concerned. Thank you.
But Dr. Khilnani, I have to ask you about the fact that whether it's the elderly citizens, those suffering with breathing issues, respiratory issues, those who are asthmatic and young children, does the air purifier provide some sense of a breathable air as in contrast with what may be outside of our respective houses right now in the national capital?
Lack of evidence is not evidence. That means just because the evidence has not been generated, it doesn't mean that that particular action doesn't help. We use so many medications because we think that it will help a person. So since there just because there is no evidence that air purifier help, because to generate an evidence you require large longitudinal studies, and there are very few places in the world where such studies can be conducted because that AQI is not so high in other places. But the common sense says that those who have chronic lung disease, or young children who are severely asthmatic, those who are on continuous oxygen, or chronic lung disease or heart disease for that matter, for them it is likely to be of some benefit, but that needs to be documented.
Dr. Khilnani, kindly stay with us. I have some more piece of information that I would like to bring to our viewers, and I will come back to you to get more information on it. You might find this hard to believe, but the government says that breathing Delhi's toxic air does not have a proven direct link to lung disease. Now, in a written reply in the Rajya Sabha, Environment Minister Kirti Vardhan Singh has said that there is no conclusive data linking high air pollution levels to lung illnesses. At the same time, the minister admitted that the air pollution can trigger respiratory problems. He was responding to BJP MP Lakshmikant Bajpai, who raised concerns over rising cases of lung fibrosis and declining lung function in Delhi-NCR residents. Studies suggest prolonged exposure to hazardous air can damage lungs, but the link is not yet confirmed. The minister highlighted government measures to protect citizens' health, and these include training for medical staff and frontline workers, educational campaigns in multiple languages, early warning systems, and air quality forecasts. Programs like the Pradhan Mantri Ujjwala Yojana provide clean cooking fuel to women and children, reducing indoor air pollution. The minister also cited the Swachh Bharat mission, which also now includes Swachh Hawa initiatives aimed at improving air quality across cities and rural areas. So while a direct link to lung disease remains unproven, the government says it is taking steps to shield vulnerable populations from the harmful effect of the pollution. Our esteemed guest continues to be with us. Dr. Khilnani, you've heard what the government has to say as far as there being no direct link as far as Delhi's toxic air is concerned or any breathing ailments are concerned. He does say it may trigger respiratory issues, but it is not a proven fact yet. How do you respond, Dr. Khilnani?
I can only talk about my experience because I do see two types of patients. One, those who are healthy, uh, they have no respiratory illness. They come with shortness of breath, cough, dryness of mouth, and tightness in the chest. Sometimes they are short of breath while their X-rays and everything is normal. And I also see patients with asthma and COPD who come with what we call as exacerbation. Uh, as I said, to generate a scientific evidence, the large studies have to be conducted. If there are no studies, there are no studies. You can't do anything. But we all know that the polluted air does cause symptoms of cough and increase in the attacks of asthma.
Dr. Khilnani, whether people feeling a case of parched throat, the dryness of mouth, like you've mentioned, there are certain other upper respiratory infection, for children, the spasmodic cough, bronchitis, all these issues, if they are generally facing it, and when you are breathing the toxic air with pollutants in it, does it get compounded?
Yes, it does increase. It does increase the symptoms. We all know.
Dr. Khilnani, I also wanted to ask you that you mentioned very categorically that the reading on the air purifier is not absolute. Would you elaborate on that?
Nanoparticles stopped by the air purifier. And I need to call off, and I'll just tell you something about the mask, or in case you want to apprise the public of it. I just want to tell everybody that please do not go for early morning walks or exercise during the smog is there, because the toxic pollutants are at the breathable level. Whenever you want to go out, use a N95 or N99 mask. I want to tell you, although initially you will feel quite claustrophobic, but there are studies done during COVID time when they made elderly people walk with the mask on, and there was no decrease in oxygen saturation, meaning thereby that by using a mask, your oxygen level does not go down. You may feel a little breathless in the beginning, but once you start using it regularly, you will not feel awkward. And there is common sense says that if you use N95 or N99 mask, you will be benefited. You should spend as little time as possible outside and avoid going to the crowded places, especially for the people who are vulnerable. If you follow these advice, you will be to some extent protected from adverse effects of air pollution.
Okay, Dr. Khilnani, I would want to bring your attention back to what the government had said in a written reply in the parliament, where they're saying that whether it's a case of lung fibrosis or other such declining lung function issues in Delhi-NCR residents, it may not happen due to pollution, but can we ignore the fact that people are facing breathing issues, and that is the reason why the government needs to be cognizant of that as well?
Oh, evidence is evidence. What Honorable Minister has said is based on the studies or lack of it. So I have no comments on it.
Okay, and I would want you to try and elaborate also, Dr. Khilnani, on the numbers that we often see on the air purifiers, whether it is over 400 outside. Often with the air purifiers, we see it's around 150, 200 inside. Are these numbers something that we can rely on, or are they not absolute numbers?
So what it gives you is a number of PM 2.5. You know, what air purifier gives you a number majority of times is PM 2.5 has already narrated that there is something more than 2.5 in the air pollution that needs to be understood.